All right, our next presenter is Parag Chitnis of George Mason University. Parag is going to talk to us about wearable ultrasound system for assessing muscle function during physical activity. I'll play another short video that provides an overview of Parag's session, and afterwards we'll have a live Q&A.
Hello, my name is Parag Chitnis. I'm an associate professor of bioengineering at George Mason University. And today I would like to talk to you about our work on wearable ultrasound systems for assessment of musculoskeletal injury and recovery. According to World Health Organization, over 1.7 billion people are affected by some sort of musculoskeletal injuries worldwide. And this inflicts a significant economic loss as well as impact on people's quality of life. Major challenges include lack of direct measures of muscle function during physical activity and exercise, and this lack of feedback hinders an efficacious treatment or rehabilitation regimen. Currently, if somebody is injured, they go through a physiotherapy and go through strenuous exercises in hopes that the muscle groups get stronger or they recover the movement that have been affected. But there is no quantitative assessment of this treatment efficacy. Usually the clinicians will look at qualitative movement measures or physical examinations and palpations. Research laboratories are equipped with more sophisticated equipment such as motion capture and force plates that can provide insights into biomechanics and kinematics, but these do not translate to clinical practice and mainstream. We interviewed several clinical care providers, and over again they said that if they really wish, they could peel back the skin and look at the muscles during physical exercise and activity. So there is a critical need to assess muscle function during dynamic activity and rehabilitation exercises. And ultrasound imaging can potentially address this need because ultrasound can provide non-invasive images of tissue under the skin during dynamic activity. As can be seen in the video shown on the left, the 2D image sequence can show different muscle groups moving and contracting during dynamic physical activity. Now, this 2D image shows a good bit of information about muscle structure and how it's moving and changing. But sometimes, even by looking at a single line within this image over time, we can gain some useful information, as can be seen in the bottom part of the video. And this is very important for us because traditional ultrasound systems are fairly unwieldy and cumbersome, as seen in the picture on the right. They're usually large instruments and systems with a transducer that has to be mounted and strapped onto the body, which is tethered to the instrument. This is not very conducive for real-time ultrasound imaging and sensing during physical activity. But with the insights that this single line in the image observed over time can still provide some useful information, our group decided to build our own ultrasound system from the ground up, thus simplifying our approach. We call our approach simultaneous musculoskeletal assessment with real-time ultrasound or smart ultrasound. And we have developed our own patented technology called time delay spectrometry for ultrasound sensing. And the main advantage is that we are able to use low voltage, long duration transmit chirps instead of conventionally very high voltage, short pulse sequences. And this allows us to use electronic components that can be very easy and cheap. These are basically components you can find in your car radio. And that allows us to simplify the system, miniaturize it, maybe even make it battery powered. And now these miniaturized systems can be used to image muscle activity and function during dynamic physical activity and exercise. So our approach of smart ultrasound and miniaturization of electronics allows us to go from this cumbersome, unwieldy ultrasound system like shown on the left to something very compact and low form factor with a transducer that's attached right here on the thigh and a little tiny box on the waist. And this is now far more conducive to real-time ultrasound imaging during physical activity and exercise. And with a system like this, we can now start to look at signals coming directly from muscle compartments during dynamic physical activity. Here we illustrate that with a counter movement jump This is a very routine exercise that's done to evaluate health and function of lower limbs and joints like knee. And you can see clearly that the ultrasound transducer that's attached to the quad muscle is able to provide real-time biofeedback on the muscle activation and function during this jump exercise. The simplification of our apparatus and setup also allows us to simultaneously examine different muscles or anatomy at the same time. So in this case, we have sensors placed on both legs and two different sites on each during a squat exercise, and the subject is standing on a force plate. The force plate data is shown on the bottom left, and we can see that the ultrasound measures from each of the sensor channels, shown in the yellow rectangles, correspond pretty well with the force activation patterns we see from the force plate data. This type of experimental analysis is also used to cross-validate ultrasound sensor signals, so we can get better insights and understand how to interpret ultrasound signal data to better understand human biomechanics and movement. And that can provide better insights into injury and rehabilitation. So to summarize, smart ultrasound is a wearable technology that can enable real-time assessment of musculoskeletal tissues during exercise and rehabilitation. Ultrasound-based biofeedback can help personalize therapy and rehabilitation to improve treatment outcomes. Other applications that we envision from our technology include personal fitness, athletic training and sports medicine, military health, stroke rehabilitation, and assessing risk of falls in elderly populations. Hello.
Thanks so much, Parag. That was interesting. And let's see what questions we have for you for your session. So if you haven't already, please pop your questions into the Q&A. I'll get started with one from Carrie Sager. So Carrie's asking, are there certain muscles that the smart system works better on than others?
No, it can really be used in any anatomical location. We started out by examining muscles and tissues in our forearms, in our hands, and then we moved to lower limbs and looking at quads and also below the knee in soleus and gastroc. So really, there's no major limitation. The only issue would be to make sure that the system can be tuned in terms of how deep we image. So if you're looking at larger muscles, such as in the quad, you have to make sure that the system is optimized to get penetration in the body at least several centimeters, so we can see those big muscles all the way through.
Gotcha. And Richard Lovett is he's asking, well, first he's saying this is so cool, and we agree. How much would this cost a physical therapist? And do you have any idea when it will be available?
Yeah, so currently our research work is funded by several US DoD and NIH grants. And the mandate definitely is to translate the technology. In fact, one of our grant requires us by the end of it to go through FDA clearance, so we can go through clinical studies for rehabilitation. That is definitely our goal. In terms of cost, actually, our effort has been very focused on simplification of instrumentation for a specific application, which is the musculoskeletal injury assessment and rehabilitation. So that has allowed us to really reduce the complexity and thereby also reducing the cost. So just to give you some examples, the sensors that we're using, they cost less than $10. The electronics we have developed in-house, and there's of course an R&D cost associated with it. But the components that go into it are not that different from a FM radio you find in the car. So we envision moving forward that rehabilitation clinics will be able to purchase these systems for the ones that's shown in this image, for example, probably for just a few $100s. And then if you have different levels of sophistication and different number of sensors, then that may change the cost accordingly. But we're working really hard to make sure that the technology is accessible in different categories for at-home use, for gym use, for rehabilitation clinic use, and also for more sophisticated applications or more high-end applications. So there should be a spectrum.
Gotcha. Thanks so much, Parag. We have a couple more questions from Richard Levitt to run by you. So, does the SMART system show how muscles behave at multiple depths?
Yeah, so the traditional ultrasound imaging is a 2D image. And if you do multiple images, you can get a dynamic video sequence. So you have depth information as well as lateral information to make a 2D image. What we have done is we've sort of decided that we don't need to look at a full image. We just pick a single line. But the depth information is still there. So we are able to identify different depths that correspond to different tissue types. So if in one particular image line, there are two different muscle groups, we can see the interface of the fascia between those two muscle groups and choose to only examine, for example, the signals from the lower muscle instead of the upper muscle. So that capability is there, and we're actually working to incorporate some AI tools to help with the selection of appropriate tissue structures and the signal analysis in an automated fashion so that the end user, the rehabilitation expert or clinicians, they don't have to fuss with all that, and they just get a biofeedback signal that's easy to interpret.
I see. Okay. That sounds really interesting. Can we have one more here that again from Richard is how much is currently understood about interpreting the results? So Richard's a running coach and he's thinking about diagnosing injuries and providing specific treatment and determining what exercises work best.
Yeah, that's a great question, and it is important to contextualize any new type of sensing technology with other tools that we understand pretty well in the context of this use case or this space. And so this is exactly what we do. We collaborate with sports medicine, athletic trainers, experts in kinesiology and biomechanics at our university. In fact, most of our data collection is done on university athletes. And we have a facility in the field house, which is fully equipped with a 16 camera motion capture system and a split force plate. So these are traditional biomechanical tools that help folks understand human movement and force generation and joint angles, things like that. And what we are working hard to do right now is cross-validate our ultrasound-based measures against those traditional biomechanical tools. So those biomechanical tools cannot be deployed in real-world setting or ambulatory setting outside, or when somebody is running, as you said, or even climbing the stairs. But our wearable and portable ultrasound sensors can. So if we can take our wearable technology and cross-validate that against these more sophisticated but obviously fixed large systems, then we can better understand how to interpret our signals. And in terms of how to look at that in terms of injury, we're collaborating with physiotherapists right now to understand which different type of exercise paradigms are used to assess not only the injury, but also recovery over time. One important aspect of our technology also in that regard is that when somebody is doing a particular rehab exercise and they're targeting a specific muscle, body tends to do a lot of compensatory movement if somebody is not paying attention, incorrect movement, which hinders progress and treatment. So our sensors can give feedback from the specific target muscles to clinicians and the patient so that we can ensure that the target muscle is indeed being activated and is indeed being worked on when they do the exercise.
But that sounds like it's going to be so promising when it's available to to use, in the wide world. When that happens, we have one last question for you, and it relates to this. It's from Avery Thompson, and it's how easy will it be for medical professionals who are less familiar with ultrasound imagery, such as the physical therapists and sports therapists you mentioned, to interpret the data from the device?
That's exactly a very important consideration. So we before we started the development of the next generation device in our lab, we interviewed 11 athletic trainers and physical therapists, both in the military, DoD, as well as civilian population. And over and over again, their comments were that they would love to have tools that allow them to peel back the skin and look at the muscles during movement. Ultrasound seems really interesting and neat, but they just don't know how to use it well or how to understand the images. So this is definitely a concern. And so what we're doing is leveraging AI tools and analysis signal processing tools to provide feedback that's very easy to understand. To give a simple example, one approach that we're developing now is if somebody is doing a particular exercise and they have to, let's say, do 3 sets of 15 reps, then consistency is important for some of these exercises. And the signals that we get from our sensors can be converted into a simple audio signal. And the pitch would simply change if they deviate from their exercise pattern or if there's inconsistency. And that could be routed through their phones into their headphones, or the system could have a small speaker and you just get the tone, and the tone could change. So we're working hard to create these very easy to understand biofeedback signals where the interpretation is straightforward, almost intuitive.
Well, thanks so much, Parag. Thanks for answering some great questions. If you didn't put a question in that you wish you had, you can email media@aip.org and we'll connect you to Parag. And if you'd like to see the press release about his research, you can access it in a link will pop into the chat for you in just a minute or two.
Thank you. It was my
Thanks
pleasure.
so much, Parag.